All right, good morning, everyone, and thank you for all being here. This is an update on the COVID-19 endemic management strategy, which I think is a distinction that we want to make. Dr. Chan, thank you for being here, filling in for Dr. McDonald today. It's always great to have Phil with us at the press conferences, but also all the work that you've been doing over the last couple of years and immediately during the time frame that I've been governor. Thank you so much, Doctor, for that. Our Education Commissioner, Fonte Green's here as well. Ana Navaz is also here from the Department of Health and on the transition team, representing the transition team that now is several weeks into that transition. So Ana, thank you so much for that work. Our main focus today is to provide updates on Rhode Island's strategic efforts to manage COVID-19 effectively as a preventable and treatable disease, shifting from pandemic management to endemic management. This includes highlighting new guidance states recently received from the CDC. Before we get into the endemic updates, I'll start with a quick look at Rhode Island's current COVID data. We're continuing to see encouraging trends in our numbers. Lieutenant Governor, come on up. Thank you for being here. Since the early January peak, cases are down by 98%. New cases over the past 7 days are declining, down nearly 57% from 2 weeks ago. Our 7-day average for percent positivity is down 41% from 2 weeks ago. Right now, we're just about 2%, and our hospitalizations have dropped 79% since peaking in mid-January. I was with Dr. Jha last night at the University Club at a child's mental health clinic, in terms of really talking about what's going on. And Dr. Jha is very, very pleased and said how well the state's doing, especially on the hospitalizations, and pointed out our vaccination rate. So it's good to have that supported by not only the Department of Health, but also people that we consider experts and nationally. He just got back from the Vatican, by the way, brought in because of his work here, right out of Brown University. So that was great to hear. So we've been here every week updating Rhode Islanders on these trends and sharing information, how data guided our decisions and how it will continue to guide our endemic response. And that's what I want to talk about next. Just like Rhode Island, states across the nation and the CDC are moving towards smart, sound strategies to manage COVID as an endemic. I was on a call with the governors a few weeks back, about a week ago, and one of the governors was really recommending that we, instead of just skating where the puck is, let's skate where the puck is going. And I think that they have responded very, very well to that, to give us the guidance that we need to support the moves that we have started to make a few weeks back. Last week, Rhode Island received new guidance from the CDC related to this nationwide shift. I want to talk a little bit about that now, and then Dr. Chan will get into more detail and the science behind it. The CDC is now using a new community transmission model that considers multiple metrics: the number of new COVID-19 cases at the county level, percent of hospital capacity devoted to COVID-19 patients, and third, the number of new patients with COVID admitted to the hospital in the past week. I think next week we'll have data in terms of during the high peak of who was in the hospital because of COVID, who was in the hospital just happened to have COVID, and who might have been there in the hospital as a result of potentially either or. We hope to have that update to you next week. I think it's a good information to have, especially from a past reference, as we continue to show the people in the state of Rhode Island that we are relying on the science and the data to move us in this direction that we're talking about today. So here in Rhode Island, we will be using this updated comprehensive community transmission model to monitor COVID-19 going forward. Under the CDC's new model, Rhode Island is identified as low community level. This is very good news. Not a surprise to us here in Rhode Island who've been following this data, but it's good to see the CDC recognize that where we are today, this year, and where we were last year at the same time is a world of difference. And the difference has been, in Rhode Island, is the response to the vaccinations. Rhode Island has responded, and the people in the state of Rhode Island have responded better than any state in the country over the last 12 months. And we hope that that's going to continue on the boosters. We expect that we'll be #1 on the boosters in short order, and that's our goal, and that's our effort right now. So right now, our team at Department of Health is working to update Rhode Island's COVID dashboard to reflect this update in a clear and simple way for the public to access. We'll have more to share on that soon. New child care test and stay monitor framework, I'd like to talk about that quickly. I know that the child care have been asking us for some support, and I think that we're answering that request today through the Department of Health in terms of what we're going to be doing there. We're announcing new recommendations and support for licensed child care organizations based on the newly defined high, medium, and low community levels from the CDC. This is another piece of our endemic management strategy here in Rhode Island. We know that we want students in the classroom, right, Commissioner? We want the students in the classroom, and we know that we need to have families be able to have their young children in our daycare centers so that they can go to work and also to manage their families' needs. We know families and young children and child care providers have been struggling, and we want to provide a new approach that will continue to ensure safe access to care while addressing the disruption to families' lives. These recommendations are based on science, data, and the best practices. The Department of Health is now recommending child care programs use a test-to-stay approach when the state is at high level, at risk, and monitoring to stay when at low or medium levels of risk based on the new CDC community transmission levels. This only applies to asymptomatic staff and age-eligible children. All others will need to quarantine per Rhode Island Department of Health's existing guidance. Given that our young children still do not have access to vaccine, and we want to encourage providers to implement the level of mitigation that is right for their community, the state, and will be offering free tests through June 2022 to licensed child care providers who choose to implement a test-to-stay program. I think that some of you have already heard that the FEMA reimbursements have been now extended from the end of March 31st, to the end of June 30th. And this allows us to continue to provide these services at no cost to the taxpayers in Rhode Island, and also making sure that we can manage the finances in terms of implementing a program like this. Anna will be able to answer questions if you have more details on that child care. Alternative quarantine approaches for child care have proven effective in neighboring states, and we're confident they will be effective in Rhode Island for Rhode Island families as well. Our start date for this updated quarantine guidance will be March 14th. Next week, the Department of Health and the Department of Human Services will be running training for providers, sharing information for providers to send to families providing information on how to request tests. I also want to give a quick reminder to the federal transportation mask requirement for school buses has been lifted, and like masking in schools, it will be a local decision. Before I wrap up, I want to remind Rhode Islanders that a critical part of the endemic preventative strategy will continue to be getting people vaccinated and getting people their booster shots. This is one of our highest priorities right now, is the booster shot program. And you'll see new faces talking about why this is important to do it. We're really going down deep into the communities where community leaders can really deliver this message. And as Dr. Jha said last night, that we need to continue to be on our toes. We need to continue to be cautious about potential down the line flare-ups of different types of variants. And the best way we can make sure that we work our way through any potential flare-up is by vaccination and boosters. And we're going to have local community leaders explain to everyone in their communities why that is really important. So if anybody would like to be a volunteer to deliver that message, we're starting to develop the messaging to make sure that we penetrate each and every community in the state of Rhode Island with a focus on those communities that have not been vaccinated to the degree that we believe they should be. Right now, the name of the game is staying up to date on your COVID vaccines, just like you would for many other vaccines. Our team is continuing to double down on this effort, and I do appreciate the people in the state of Rhode Island, their response to bring us to a national level in all respects relative to this work. And I think it's very important as we move forward to make sure that our economy responds in a way that it is currently being happening, but it's all about making sure that we're providing the preventative strategies that we need to provide, and then also with Dr. McDonald, Dr. Chan, providing the treatment issues and the up-to-date information on treatment to make sure that you know, the state of Rhode Island is safe and it's healthy and the economies move forward and we keep our students in the classroom, Commissioner, right?